Welcome to Microscopic Marvels. All right, today we are tackling an extremely high-yield topic for your exams, sharp force injuries. We're going to break down how to classify them and, maybe more importantly, really get a grip on their medical legal importance. So let's just dive right in. So let's start with the absolute basics. What even is a sharp force injury? Well, it's pretty simple. It's any mechanical injury that's caused by a weapon with either a sharp edge, like a blade, or a pointed end, like a needle. That's it, a sharp edge or a pointed end. Okay, so we break these injuries down into three core types. First up, we've got incised wounds, which you can just think of as cuts. Second, we have stab wounds or punctures. And third, chop wounds. We're going to go through each one step by step, starting with incised wounds. All right, first up, incised wounds. You'll also hear these called cuts or slashes. These are super common, and they have some really distinct features that are absolutely essential for you to be able to spot. So incised wounds have a few classic giveaways you need to be looking for. They're caused by light, sharp-edged weapons, and this creates a kind of spindle shape with really clean-cut, regular margins. A huge feature is that there are absolutely no tissue bridges. And because the blood vessels are sliced so cleanly, the bleeding is usually pretty heavy. Now, here is the absolute money shot for your multiple choice questions. In an incised wound, the length is always greater than the depth. Remember that. Okay, now for a super high-yield concept you've absolutely got to know, tailing. This is a classic feature where the wound starts deeper. We call that the head, where the weapon first makes contact. And then it gets more shallow. That's the tail, as the weapon is lifted away. Forensically, this is so important. Why? Because it tells us the exact direction of the cut. So, how do these wounds help us figure out what happened? Well, when you're looking for signs of homicide, you're often going to find what we call beveled cuts. That's where the blade goes in at an angle. In total contrast, the big giveaway for suicide is the presence of hesitation cuts. These are multiple, shallow little trial cuts, usually in places that are easy to get to, like the wrists or the neck. So just lock these two phrases in your mind. Beveled cuts for homicide, and hesitation cuts for suicide. All right, let's move on to our second main category, stab wounds, which you might also hear called puncture wounds. Now, unlike the incised wounds we just talked about, stab wounds come from a weapon with a pointed end. And here's the key difference. It's the total opposite of what we just learned. For a stab wound, the depth is the biggest dimension, not the length. Fun fact, it's actually the skin that gives the most resistance to the weapon. We also classify these wounds as either penetrating, which means there's only an entry wound, or perforating, which means there's both an entry and an exit wound. Here's something that is a total favorite in oral exams, or Vivas. Langer's lines. These are basically the natural tension lines in our skin made by the collagen fibers underneath. Now, why should you care? Well, a stab wound that runs parallel to these lines won't open up very much. It'll look like a thin slit. But if a wound cuts perpendicular to them, that tension pulls it wide open, making it gape a lot more. It can completely change how a wound looks. This table shows a really fundamental idea. The weapon's shape is going to determine the wound's shape. It's that straightforward. A single-edged knife? You're going to get a wedge or teardrop shape. A double-edged dagger? That leaves a nice symmetrical spindle-shaped wound. And a screwdriver? This one creates a very unique stellate or star-shaped wound. Definitely pay attention to that last one. It's a classic question on multiple choice exams. Another really high-yield sign to look for is the hilt mark. If you see a patterned bruise or an abrasion right around the entry wound, it tells you the knife was pushed in all the way to the handle or the hilt. This gives us some really crucial information about the force that was used and the minimum length of that blade. And now for our third and final main type, the chop wound. This one's a little bit different. It's kind of a hybrid. Chop wounds are caused by heavy, sharp weapons. Think an axe or a meat cleaver. The most important thing to get here is that they combine features of both sharp and blunt force injury. So you'll see regular margins from that sharp edge, but you'll also see bruising and crushed tissue all around it from the sheer weight and force of the hit. This pretty often results in bone fractures underneath, and from a medical legal perspective, these are almost always homicidal. Okay, this table is your perfect at-a-glance revision tool. Let's just quickly run through the key differences. For incised wounds, you're thinking light, sharp weapon, length is the key dimension, and clean margins. For stab wounds, it's a pointed weapon, depth is key, and the margins are also clean. And finally, chop wounds, a heavy, sharp weapon, depth and breadth matter, The margins will have bruising, and bone injury is common. Before we wrap up, we need to cover one last critical concept that applies to all of these injuries, and that's defense wounds. Now, the importance of this cannot be overstated. When you find defense injuries on a body, it is a massive indicator of homicide. It shows that the victim was not only conscious, but they were actively trying to fight off an attacker. We split these into two types. You've got active defense injuries, which happen when the victim instinctively tries to grab the weapon. That leads to cuts on the palms, the fingers, and in the web space of their hand. Then you have passive defense injuries. These happen when the victim raises their arms to shield their face or body, and that results in wounds along the ulnar side of the forearm. All right, let's lock in all this knowledge with a super quick, rapid-fire revision of the most testable points. You ready? Okay, let's go. Incised wound. Length is greater than depth. Look for tailing. Hesitation cuts scream suicide. Stab wound. Depth is greater than length. Screwdriver causes a stellate wound. A chop wound has both sharp and blunt features. Defense wounds strongly suggest homicide. Active defense means grasping the weapon. Think palms. Passive defense means shielding the body. Think forearm. Got it? So, to finish off, I'll just leave you with a quick question to test yourself. Which injury type combines features of both sharp and blunt force trauma, and what does its presence almost always indicate? That's right, it's the chop wound, and it almost always points straight to homicide. If you like this video, then please like, comment, and subscribe.